Bismillahirrahmanirrahim. Today, in discussing the disorders of the skeletal system, we will discuss two very important conditions, and these are the rickets and osteomalacia. Both of these conditions result from poor or insufficient bone mineralization. We know that initially the osteoid seam, which is secreted by the osteoblasts and which contains type 1 collagen and mucopolysaccharides, this osteoid formation is followed by the deposition of calcium and phosphate that finally form the fully mineralized bone. So when there is poor bone mineralization, it will result in softening of the bone, and as we know that for proper bone mineralization, an adequate supply of calcium and phosphate is important, and we also know that calcium homeostasis is controlled by the vitamin D, or the vitamin D3, which is the active form of the vitamin D, also known as calcitriol, and which increases the absorption of calcium and phosphate from the gastrointestinal tract. The other hormones that control calcium homeostasis is the parathyroid hormone, which is secreted by the parathyroid gland, and a small role is also played by the calcitonin, which is secreted by the parafollicular cells of the thyroid gland. So, poor or inadequate mineralization of the bone, if this occurs in children before the closure of the epiphyseal plates, we call it as rickets. But if the defective mineralization of the bone occurs after the epiphyseal plates have been closed, we call it as the osteomalacia. For a proper bone formation, there should be the presence of sufficient supply of calcium and phosphate. Initially, the osteoblasts, they secrete the osteoid seam, which consists of collagen, particularly collagen type 1 and mucopolysaccharides. And this is known as the unmineralized organic matrix part of the bone. This is the organic part of the bone. Now, once the osteoblasts have secreted the osteoid seam, later on the calcium and phosphates, they are deposited here in the osteoid seam to make the formation of a mineralized bone. Now, the major control of calcium in the body is caused by the vitamin D3, which is the active form of the vitamin D known as calcitriol. We know that we get vitamin D in the food in the form of vitamin D2, ergo calciferol, and vitamin D3. But most of the vitamin D3 is derived from the exposure of the sun, exposure of the skin to the sunlight or ultraviolet light. The 7-dehydrocholesterol present in the skin is converted into cholecalciferol. This cholecalciferol is carried to the liver, where the hydroxylase enzymes convert the cholecalciferol into 25-hydroxycholecalciferol. After this second step, this 25-hydroxycholecalciferol is carried to the kidney, and where the alpha-hydroxylase enzyme, which is stimulated by the parathyroid hormone, it converts this 1,25 hydroxycholecalciferol or calcifidiol into the 125 hydroxycholecalciferol, which is the vitamin D3 or the active form of the vitamin D, also known as the calcitriol. Now, this active vitamin D3 then increases the intestinal absorption of calcium and phosphate. And also, it increases the renal reabsorption of calcium. So, in this way, it maintains the blood calcium level and provides enough calcium and phosphate for the bone mineralization. The osteoid seam formed by the osteoblasts, which form the organic matrix, is then mineralized by the deposition of the calcium and phosphate, also known as the hydroxyapatite. And this hydroxyapatite, which consists of calcium and phosphate, make the inorganic matrix of the bone. And in this way, bone mineralization occur, and we come to know that vitamin D has very important role in bone mineralization by maintaining the serum calcium and phosphate level. Now, the conditions in which a deficiency of vitamin D occurs can be summarized as to decreased exposure to sunlight or ultraviolet light, a diet which is poor in calcium and vitamin D, in malabsorption, for example, celiac disease and other diseases of the gastrointestinal tract, like Crohn's disease, which disturb the intestinal absorption of calcium and vitamin D, and also certain liver and kidney diseases, because we know that the cholesterol or cholecalciferol is converted into hydroxycholecalciferol in the liver and into dihydroxycholecalciferol or calcitriol in the kidney. So any disease in the liver and kidney may damage this process, and it will lead to the reduced vitamin D, calcium and phosphate availability. For example, if the kidney is damaged, we know that the active vitamin D3 is formed in the kidney. But if the kidney is damaged, there will be less production or defective production of the vitamin D3. It will be followed by poor absorption of calcium and intestine and phosphate from the intestine. This will result in a hypocalcemic state with low level of calcium and phosphate in the serum. And this low calcium state or hypocalcemia will stimulate the parathyroid gland. The calcium sensing receptors in the parathyroid gland will sense hypocalcemia, and it will release parathyroid hormone. Now, the parathyroid hormone will attempt to maintain the serum calcium level by stimulating the bone demineralization and releasing calcium and phosphate into the blood. Moreover, the parathyroid hormone, it will increase reabsorption of calcium and excretion of phosphate. So what will happen that if the kidney is damaged, it will be unable to reabsorb calcium, and as a result there will be low serum calcium level and the unavailability of the calcium and inability of the kidney to excrete phosphate. So the phosphate in the serum or blood will bind all the available calcium, and the situation will lead to decreased serum calcium and phosphate product, and as a result poor bone mineralization. So in children it will result in rickets, and it will lead to growth disorders and malformations, while in osteomalacia it will result in weak bones and increased susceptibility to fractures. Now, vitamin D deficiency is the most common cause of rickets in children and osteomalacia in adults. It will result either poor availability of the vitamin D and calcium in the food. This may form a nutritional deficiency, or sometimes in intestinal malabsorption, for example, in celiac disease and Crohn's disease, there is poor absorption of calcium and vitamin D3 from the food, and deficient or poor exposure to the ultraviolet light or sunlight, particularly in homebound elderly populations. Additionally, some medicines like penicillin and anticonvulsants, they use the kidney and liver hydroxylases, which are the enzymes that convert in the liver calciferol into 25 hydroxycalciferol, and in the kidney into 25 hydroxycholecalciferol into 1,2,5 dihydroxycholecalciferol. So if these enzymes are used by drugs like penicillin and other anticonvulsant drugs, so it will make the availability of these enzymes deficient, and if these drugs are used for long times, it may cause poor formation of the active form of the vitamin D3 or calcitriol. In liver and kidney diseases, the ability to convert vitamin D into 25 hydroxycholecalciferol, which is uh, by the enzyme 25 hydroxylase, if it is compromised in chronic liver diseases, and similarly if in the chronic kidney disease the alpha hydroxylase enzyme synthesis is compromised, so as a result it will lead to the deficiency of the active form of the vitamin D3, and ultimately poor availability of the calcium and phosphate for bone mineralization. So rickets will occur before the epiphyseal closure in children, and osteomalacia occurs after epiphyseal closure when the epiphyseal growth plates have been closed and there is no further growth in the long bones. So rickets will cause impaired growth and malformations, particularly in children, while the osteomalacia will cause softening and weakening of the bones, and the bones become more susceptible to fractures. Now, the signs and symptoms combined to the ricket and osteomalacia are the diffuse bone and joint pain, the proximal muscle weakness, and the muscle spasm and numbness, which is caused by the hypocalcemia. The bones become more fragile, they become more weakened, and are susceptible to increased risk of fractures. Now, some sign symptoms are common to both rickets and osteomalacia, while the rickets in children have certain specific signs and symptoms. The child may have a pigeon chest deformity, which is caused by the inward bending of the ribs, which causes pushing or protrusion of the sternum to the interior, and the child appears like that of a pigeon with protruded sternum. Additionally, there may be abnormal growth of osteoid in the skull bones, and it may cause frontal boosing and the prominent forehead, and this situation is caused by the osteoid deposition in the skull bones. Rheumatic rosary is another sign in which there is deposition of the osteoid at the joints between the ribs and its costal cartilages known as the costochondral junctions, and these may be visible even on physical examination and in the x-rays. Weakness of the long bones of the lower limbs may cause the knee joints to bend outward, and it will result in the formation of the bow legs, are also known as the genoverum. So in this picture we can see that this is the prominent frontal bone or frontal boosting, and this is due to the osteodeposition in the skull bones. The rhaetic rosary is due to the osteoid deposition at the costochondral junction, and the bending of the ribs inward cause in protrusion of the sternum to the interior, and this sign is known as the Rickett rosary. And due to hypocalcemia and loss of tone in the abdominal muscles, there may be protruding abdomen, and the bow legs, also known as the genoverum, is caused by the weakness of the muscles and bones where the kidney joints bend outward. Very important is the craniotabes, which occurs due to delayed closures of the fontanella and which can be felt and also seen on radiographs. Now, for the diagnosis of rickets and osteomalacia, we measure the serum calcium and phosphate level, and this will appear low or decreased due to deficiency of the vitamin D or calcitriol. As a compensatory phenomena, the parathyroid hormone level will be increased, which increases in response to hypocalcemia, and also the level of the enzyme alkaline phosphatase is increased because the osteoblasts are activated, and this enzyme alkaline phosphatase is very important for bone mineralization as it provides an alkaline medium, and we know that bone mineralization is favored by the alkaline medium. Moreover, this alkaline phosphatase hydrolyzes other components that inhibit bone mineralization. The X-ray images in rickets and osteomalacia may show signs of decreased bone mineral density. These areas in the bones are called looser zones or osteopenia. In rickets, the X-ray image of the wrist and long bone metaphysis may demonstrate metaphyseal cupping and fraying. We see these pictures in the next slide. Here we can see that the metaphysis of the long bone, due to poor mineralization, they get converted into cup-like structures, and this process is known as cupping. Normally, the metaphysis have smooth and continued surface, but in rickets and osteomalacia, what happens that this surface of the metaphysis becomes irregular and abnormal shaped, rough shaped. This is called as the fraying. In this picture we can see a normal vertebra where there is sufficient and normal mineralization, while in this picture we can see a vertebra with low bone density as is commonly seen in the disease that we have discussed in our previous lecture known as the osteoporosis, and this shows poor mineralization. So in rickets and osteomalacia, there is poor mineralization of the bones that lead to soft and weakened bones, and they are more susceptible to fractures. The treatment of the rickets and vitamin D depends on vitamin D supplementation and to treat the underlying cause. If the problem is in the liver, we should treat the disease. If it is in the kidney, we should treat the disease. If there is poor sun exposure, we must increase the exposure to the ultraviolet light. And if there is malabsorption due to celiac disease or Crohn's disease, we must focus on that. Additionally, we can prevent rickets and osteomalacia by giving vitamin D supplementations to the peoples that are at risk, and particularly during pregnancy to a pregnant female to avoid the deficiency of vitamin D, and particularly the vitamin D drops available are given to the neonates and infants to prevent rickets in these children. Thank you very much.